Good afternoon.
Good afternoon.
I didn't hear everybody. Good afternoon.
Good afternoon.
That's more like it. Thank you. I'm Brian Donahue. I'm the Director of Economic Development for the City of Portsmouth, and it's my honor and pleasure to greet you today to celebrate another historic business opening in the City of Portsmouth. I'd like to take a moment to recognize many distinguished guests who are present today. First is Shannon Glover, the Mayor of the City of Portsmouth, who you'll be hearing from in just a few minutes. In addition to the Mayor, I do believe that we're expecting Vice Mayor Lisa Lucas-Burke, Councilman Bill Moody, Councilman DeAndre Barnes, and Councilman Mark Hugel and Vernon Tillage as well. But I'd like to just recognize you all for your attendance today. Thank you. And of course, I'd be remiss if I didn't recognize Niana Byers, founder and CEO of ETSI, and the members of their team for choosing Portsmouth for their investment and the launch of this new business in our city. Thank you. As you know, the availability of healthcare services is essential to the economic stability of a community. It ensures that our residents have a guaranteed quality of life, and it provides for a ready and capable workforce in our community. So on behalf of the city's Economic Development Office, Niana, I'd like to thank you again for providing our community with much needed direct healthcare services. I'd now like to introduce the Honorable Mayor Shannon Glover for remarks. Mayor.
Thank you, Brian, and thank you everyone for joining us this afternoon. I am so excited when I talked to Niana this week, and we had a brief conversation. She said, "You know, Mayor, I'm so grateful that Portsmouth decided to support us in this effort." And what I wanted to share with her, Portsmouth will always be willing to support the effort of taking care of its citizens in terms of providing access to quality health care. And so I want to thank you again for your commitment to our city. And I want to thank each and every one of you for coming out today. This is a joyous occasion. This is a celebration. And I will begin with my comments at this time. Ladies and gentlemen, honored guests, members of the Portsmouth community, today marks a momentous occasion as we gather to celebrate the grand opening of the Ending Transmission of Sexual Infections Health Clinic, ETSI Health Clinic, right here in the heart of Hampton Roads region in the great city of Portsmouth, Virginia. This unique and specialized healthcare clinic offers a source of hope for the health and wellness of all people. Today is also special because it holds a significant place in history as the first health clinic in the United States owned by a Black transgender woman. Once again, right here in the great city of Portsmouth. And I assure you, Portsmouth is a city that welcomes first. So we stand here today not only to cut a ribbon, but also to continue our progress as a community and a nation in breaking down barriers, challenging stereotypes, and promoting exclusivity in our community. The vision behind this clinic is a testament to the resilience, strength, and dedication of its owner, Niana Byers. Niana is a trailblazer with a visionary leadership who has tirelessly worked to create a space where everyone, regardless of their background or identity, can have access to quality health care. The ETSI clinic is not just a healthcare facility, it is a symbol of progress, diversity, and the power of representation. Niana has not only shattered the glass ceiling, but she is paving a way for more inclusive and understanding in the healthcare landscape. This clinic is not merely about addressing a physical health, it is about fostering a sense of community, empowerment, and acceptance. It serves as a reminder that diversity is our strength And when we embrace our differences, we create a more compassionate and understanding society. As we stand on the threshold of this new chapter in Portsmouth's healthcare landscape, let us express our gratitude, not only to Naona, but all who were involved in making ETSI Clinic a possibility. Let us join together in celebrating this historic milestone, welcoming this groundbreaking clinic to our city, and embracing a future where everyone can access the care that they deserve. On behalf of the Portsmouth City Council and the citizens of Portsmouth, I welcome you, ETSI Health Clinic, to the Portsmouth family, and may God bless you. I have one more exercise to perform, or duty to perform, and I will begin as requested. Whereas each year, National Black HIV/AIDS Awareness Day is observed during Black History Month to raise awareness of the disproportionate impact of HIV on Black communities and the importance of increasing access to HIV education, testing, treatment, and prevention services. And whereas this year's NBHAAD theme is Engage, Educate, Empower, uniting to end HIV/AIDS in Black communities. And whereas Black communities in the United States face structural societal barriers to accessing HIV prevention and care services. As a result, HIV has a disproportionate impact on the Black population. In 2021, Black people represented 40% of new HIV diagnoses, despite making up only 13% of the U.S. population. And whereas factors such as lack of health insurance, racial bias, and lower median incomes exacerbate existing gaps and make it more difficult for Black Americans to access the social and medical resources that help prevent and treat HIV. And whereas National Black HIV/AIDS Awareness Day offers all people the chance to acknowledge the progress in HIV prevention and care among the Black community while recognizing that work is still needed. Now therefore I, Shannon E. Glover, Mayor of the City of Portsmouth, do hereby proclaim February 7th through the 9th, 2024 as National Black HIV/AIDS Awareness Days in the City of Portsmouth, and recognize that it is an opportunity for individuals and groups to promote the dialogue and educate others on the issue of HIV prevention, diagnosis, and treatment. In witness whereof, and on behalf of the Portsmouth City Council, I have hereunto set my hand and caused the seal of the City of Portsmouth to be affixed this 7th day of February 2024. Thank you.
Thank you, Mayor Glover. I'd now like to ask Dr. Matthew Rosario, consultant with ETSI Health Clinic, to come forward for additional remarks. Dr. Rosario.
Good morning, good afternoon. How's everybody doing?
Good.
Can everybody hear me?
Yeah.
So I hate public speaking, so we're gonna just throw that out there, but I'm actually really good at it. So where do I want to begin? Because I do not have a script, and I usually have a script, and I'm like, you know what? Let us be authentic, because we completely give versions of ourselves. And so I'm going to give the version of how did ETSI Health Clinic come to be, right? When we talk about resilience, we talk about challenges. We talk about the ability to overcome the obstacles within our lives. Ms. Byers have been able to come over those obstacles from an adolescent now to an adult, being able to create a system of systematic uniqueness to provide HIV and AIDS treatment here in Portsmouth, Virginia. This journey was long. We started this back in 2019, where Ms. Byers and I were working at an agency together. And she pitched an idea to end the stigma of HIV in the Black, brown community, specifically within the transgender services. We wrote a grant, We got the grant, and we're like, oh, and I do curse last, so I do apologize. We're like, oh, now we got it. But now what do we do with the allocation of the funds, because every services are similar, but we want it to be different. Similar service throughout the state of Virginia shows that there's a disparity, and the disparity is how do we use the resources, but then how do we provide culturally competent care? I'm gonna wait for that to pass. How do we provide culturally competent care? The mental health industry and also the medical industry, as we know, is a system. And within that system, it can be really detrimental to how we provide our services. So when we first created Empowering Transgender Services, our focus was on transgender care, affirming care, and HIV testing. Over the course of the development over the past 2 years, that vision has changed. Although we still specialize in gender affirming services and gender affirming care, the mission has changed. The mission has changed to provide equal opportunity to those here in Portsmouth, an avenue to get tested in a safe, but also feel that they have people that they can relate to. Cultural competence means us having the understanding and the empathy to provide service based on someone's systematic belief, but also being accepting. So I encourage each and every one of you today is to take that challenge of being culturally competent and providing services from your heart, but not how it can how it can align our pockets. Too many businesses align their pockets for the benefit of other people. Let's provide services to humans first, and then worry about the money in the back end. Money will always be there, but how we provide services to people will be long-lasting. To end these disparities, we need to be able to speak up and talk about the challenges that we face as providers, but also the challenges that we face within the unique communities itself. It is time to bring attention, not without the adversity of being scared to communicate and advocate for what we need, but being able to communicate about what we want in order to change the system that we have. One of the things that Ms. Byers has dedicated her life to is changing the systematic oppression of the LGBT community by providing services, but then also advocating the needs for us. There has been moments where it has been fights. There has been moments where there has been tears. There has been moments when we did not know this was going to happen, but today it has happened. The blood, sweat, and tears that Ms. Byers has put into this agency is a testament to her ability to wanting to show the community who she is. She is a Black transgender woman that owns the first U.S. health clinic in the United States. And that is so big. It is so big because there is too many of us in the LGBT community that allow our sexual identity, sexual orientation to define our future instead of allowing our ambitions and our pride to change the systematic systems that we have here in Virginia and throughout the states. We do want to give a shout out to Gilead Health Sciences, Trans Center Fund, Strategy Funds, who provide the resources for us to open up this clinic here today. Without them, we would not be here. So back in 2019, we had a vision. We had a vision to provide HIV testing in Hampton. What we learned throughout the development of data and research is that here in Portsmouth, there was a need, not only within HIV, but also in substance abuse. So expanding within our services, we are looking at including harm reduction services here to include substance abuse treatment and peer support in order to help, because there is a linkage between HIV and substance use. We do not believe that an individual cannot be saved. Everyone can be saved, but we must not give up on the world. Too many of us give up on the world because we have the challenges, but this woman here will not give up on you. This woman here will not give up the challenges. Does not matter the oppressions or the pushback that we have gotten over the past 2 or 3 years. We are still here. We are still standing. And I want to welcome all of you guys into our family. We have worked hard to get here. So I'd like to take this moment to thank each and every one of you guys for coming out here to celebrate this milestone with us here today.
You're here.
With that being said, as ETSI Health Clinic will begin its grand opening and starting to open here on Monday, I want everyone to take a pledge to come here on Monday and get tested, know your status. It is really important for each and one of us to know your status. HIV is no longer a death sentence. We have too many medicines, too much research, too many resources that we can use to prevent the spread, but also to prevent the transmission of HIV. We are not only focusing on HIV anymore, we have expanded the services to all STI, gonorrhea, chlamydia, thanks to our physician, Dr. Mark Enos. So let's go ahead and give him a round of applause. So, With that being said, I'll have the privilege and honor to introduce Ms. Nyana Byers, who would like to give a few words to each and one of you guys. Thank you.
Thank you, sir.
This has been a journey, but a journey that has been worth the while. I love my community in a whole, and it's just not about being trans, but I love my African American community. The services that we are providing are not just for the transgender community, but for the whole community in a whole. We're going to continue to do this work no matter how frustrating it gets, no matter how we get pushed back, we get no's. Our no's eventually turns into yeses. I'm so grateful to be standing here, and I'm so grateful for the city of Portsmouth. Ever since I first met Mayor Glover Shannon, in Newport News, he's just been so welcoming. And that really touched my heart, because I remember once upon a time where we was in a city and it wasn't that welcoming. I'm just grateful, and I give God all the glory. I give the people that work with me in the future, in the past, and they're in the future, I give them my thanks for believing in my vision, because I can't do this by myself. It takes an army to end HIV. I said to the news reporter last week, Martin Luther King fought for the freedom of our rights. I'm something like Martin Luther King. I fight for our rights. I fight for the disparities of African American people, and I'm fighting to end HIV. And I always say to myself, why isn't it a cure to HIV? It's just we have more work to do. Thank you. I would like to introduce San Juan Austin, my director.
Good afternoon, everyone.
Good afternoon.
I just want to say thank you for your time and your support in joining us today in our ribbon cutting ceremony. I didn't think that I was going to have to say anything, so I wasn't prepared. But what it say, be ye also ready, right? So I just want to say that I met Nyana in the early 2000s, and we clicked. Became real close friends, and it was a time in her life where things wasn't going well. And can I talk? And Miss Byers ended up doing some time in prison. And usually everyone knows when you have family members, sometimes your family turn their backs on you and you have nobody, right? And so my friend did 10 years, and I was there every step of the way. There was nothing that she wasn't going to have if I was around. I made sure she was good. And I remember getting letters from her telling me that when she got out, she was going to have her own organization that helped black trans people, and she was going to help get trans rights. So you know how we do. We get these letters like, oh, okay, all right. How we gonna do this? Oh, okay, I see it. But when she got out, everything she said she was gonna do, she did. And that's why I'm standing here, because she had this vision so long ago, and it came into existence, and it's here. And I said, you know what? I'm gonna support you the whole way. Well, I want to get you to work for me, but I don't have the money. I ain't worried about the money. I have a job. I want to help you get this off the ground. I want to help you get where you need to go to. I ain't worried about the money. She was like, no, but you got degrees. I don't care about them degrees. I'm here to help, because the mission is to give back and help the community. You know, HIV is dear to my heart because I've lost a lot of people that I really love to HIV. It's a lot of people that I care about and I love right now that's HIV positive. And if I could do anything to end that stigma, I would, because I know what they go through. I know what they've been through. So to have something so powerful and unique as ETSI that's giving back to the community, and it's free. It's free. You don't have to pay for it. You don't have to struggle. You don't have to go back and forth with insurance companies. It's free. So, as Dr. Rosario said, HIV isn't no longer a death sentence. We're living. People are living. You can live with this. You can have a great quality of life. And it's people like Nyana that has this company, this clinic that's going to help prevent, treat, and educate. It's going to be so powerful. But we need each and every one of you to support us, tell a friend, and keep us busy. And we're going to do everything we can to end this stigma. So thank you again for joining us. I'm grateful. I'm just happy to be here. And this is history. This is history.
Well, just thank you is what I want to say to that, for sharing your story, each and every one of you. I think it is the Portsmouth story as well, that this is a welcoming community, a diverse community for individuals and businesses. And again, I'd like to express my gratitude for your choosing Portsmouth as your home. So with that comes the fun part of this event, and that's the ribbon cutting. So we're going to set the ribbon up, and we're going to distribute scissors. If you'd like to invite your team and some of our distinguished guests as well. I think we have our Vice Mayor here in attendance. Councilman Hugel is here as well. If I could ask you to come forward, we're going to set up the ribbon. We're going to cut it, and then I think we're going to go take a tour as we open the doors for ETSI Health Clinic here in Portsmouth, Virginia. Welcome to Portsmouth!